Always trust.
I'm Gabriel Zondo at the United Nations in New York, where the Security Council has been briefed on what has become the world's biggest humanitarian catastrophe, Sudan. Tens of thousands killed, millions displaced, famine looming, and a shattered health system unable to cope with nearly 2 years of conflict. But Sudan is just one of many crises. From Gaza to Syria, the Democratic Republic of Congo, and beyond, global emergencies are multiplying while our collective ability to respond is shrinking. Our world today being tested, not just by the scale of suffering, but by dwindling resources, deepening mistrust, and in increasingly dangerous situations for humanitarian workers. For more than 50 years, Médecins Sans Frontières, or Doctors Without Borders, has been on the front lines, providing emergency medical care in conflict zones and disaster-stricken regions. Awarded the Nobel Peace Prize in 1999, it's one of the world's largest humanitarian organizations. But its mission is facing growing challenges. The Trump administration has slashed funding for humanitarian aid worldwide, threatening the lifeline millions depend on. Although Doctors Without Borders operates independently through donations, can it fill the gap left by cuts to UN and other aid programs? So how does the organization navigate a world where humanitarian workers are under attack and underfunded, and where the most vulnerable are losing faith, not only in aid organizations, but in their governments and even humanity itself? Christopher Lockyear, the Secretary General of Doctors Without Borders, talks to Al Jazeera. Christopher Lockyear, thank you for talking to Al Jazeera.
You're very welcome. Thanks for having me.
Doctors Without Borders is one of the more famous humanitarian organizations in the world. It was founded just a little over 50 years ago by a group of 13 doctors and journalists after a war and famine in Nigeria. And today, MSF has done 16 million medical consultations. So I asked someone in your office, I assume that's in the last 50 some odd years since you've been around. He said, no, that was just on average per year.
Yeah, and what I would also dig into that number in a bit more detail. We do surgical interventions, we treat kids with malaria, we do vaccination campaigns, we do child and maternal health. And so there's a whole range of things that we do. So ranging from almost public health, water and sanitation, tuberculosis treatment. So a medical case is not just a medical case. There's a huge range of expertise in our incredible workforce around the world.
You know, every organization comes under some sort of scrutiny, including your own. About 5 years ago, more than 1,000 MSF employees and former employees signed a letter saying that the organization is institutionally racist and it's run by, in their words, privileged white minority. What has MSF done to address that today?
Well, firstly, what I would say is these comments really sparked an in-depth and very robust conversation within the organization as a whole. And so I think it's something that we try to embrace, try to understand. And what we did with this was really try and analyze where the barriers were in the organization, the vast organization over 70 countries, as you said, for people from different backgrounds to progress, to have access to different parts of the organization as a whole. And what we did as a consequence at this time was we developed an action plan that had 7 different categories in it of where we thought there were barriers or different people within the organization faced different conditions. And these ranged from issues around safeguarding, issues around risk and security, because sometimes if you're a local staff member, you may be facing different risks in a war zone than an international staff member, to our pay and reward system, to access to issues around learning and development within the organization. And what we do now on an annual basis is publish our progress. And we've made some great progress. We've still got a long way to go. The world is changing and we're trying to change with it. There are many areas we should have changed faster. There are also many things that I have been and remain proud of in an organization. It's an organization in which these voices as a whole are welcomed, and we welcome dissent and debate and contradiction. So it is, I think this has been an important moment for us. But what it's also shown is that the real value of diversity in an organization such as ours, it's not just saying it because we think it's the right thing to do. We do think it's the right thing to do. But at the same time, it brings better quality outcomes when we have a diverse set of voices around how to treat medical situations in difficult places, but also how to run the organization. That diverse view of that diverse set of voices gives more robust outcomes and allows us to plan better.
Let's move on to cuts to humanitarian aid. As you well know, humanitarian funding is being decimated right now, led by the Trump administration, who has dismantled USAID and pretty much halted almost all aid funding globally. And the U.S. accounted for about 40% of all global humanitarian funding for decades. But at MSF, you are shielded from it a little bit, I believe, because about 90% of your funding comes from private donors.
More. No, it's only less than 1% from government funding, so more than 90%.
Less than 1% government funding. And how much from the United States?
None. We don't.
Zero.
We haven't. We don't take money from the U.S. government.
So I guess the question is then, how are cuts to other non-governmental organizations going to affect your work in the field?
Yeah. Well, maybe if I can take a little bit of a step back, because I think what you described here is very accurate, but it's also part of a bigger picture. The aid cuts that we've seen from the US are huge and massive and consequential in themselves, but it's part of a broader trend as well. It is not just the US. We've seen several countries in Europe, for example, reducing their aid budgets, their development budgets. So it's part of a global trend. You're right, the US was the major stakeholder in many contexts. And you're also very right to say that we are somehow shielded from it as an organization. And what this does is, it's not just a financial point, though. It's also a point on independence. It's a point on being able to adhere to humanitarian principles, which is why we've made this decision in the past, to make sure that as we have an independent of fundraising or financing, we can be independent in terms of the decisions that we make. And that really means that we can make the decisions to go where the needs are greatest, rather than where is politically expedient for our donors. And that's due to the generosity of 7.3 million private donors around the world. And what I would like to do is reflect on that these 7.3 million private donors around the world. It's not just a funding source. We see this as a source of partnership. It's also a symbol of solidarity for people around the world as a whole. Now, to get to your question, yes, it's having impact all around the world. I mean, I was in Sudan a few weeks ago, and as I was there, we were hearing reports of organizations having to stop activities. In Nyala, which is the capital of South Darfur, where we have a very big hospital, which had been completely decimated by the conflict there were organizations telling us that they had to stop private healthcare, primary healthcare activities, and water trucking in a situation where you have tens of thousands of displaced people. And that is just one small illustration of the impact that these cuts are having around the world.
But the humanitarian is an ecosystem, right?
Yes.
You all work together in some way, shape, or form.
Yes.
So I have to imagine that this potentially could affect your work when partner organizations are having to halt programs.
Absolutely. And we are in the situation where we will try and do more to help cover some of these additional needs, but we're not going to be able to fill that gap. We are a piece of the puzzle, a piece of the puzzle that I'm very proud of and very pleased to work with, but we're a piece of a much larger system in that sense, and I think we're a unique and special part of that system. But we are not going to be able to compensate for this. We are seeing in Syria, in hospitals in Syria, patient numbers going up already. It's a threat to the work and the development in the global health arena that's been happening in terms of combating communicable diseases over the last decades. So really, we're bracing for a period of uncertainty at best, and a period of real degradation in terms of global health, more realistically.
Do you see a moment in the coming weeks or months that you'll have to make very tough decisions about where you put your money and your resources?
Well, we have to make tough decisions about where we put our money and our resources on a daily basis. I mean, there are always more needs, more humanitarian needs out there than we have the capacity to reach ourselves. But yeah, we're going to be forced with more excruciating decisions as a consequence of these aid cuts. I mean, which programs can we take over from other organizations? Which other organizations can we support to go further? I mean, we are taking this extremely seriously, and we are discussing and trying to work out the best route forward on a daily basis. So those hard decisions in terms of where do you put not just your money but your people, as importantly, because they're the people who are, our medics are the people that are treating the patients. Where do we prioritize? Which patients around the world do we prioritize? It's going to get even more complicated as a consequence of these cuts.
Because behind these numbers are people.
Absolutely.
People that are relying on organizations such as yours to keep them alive in some cases.
Absolutely. And I have no doubt that with the extent of these cuts, lives are going to be lost as a consequence.
Is the humanitarian world facing its worst crisis right now in the last 75 years?
I think the humanitarian world is reeling as a consequence of these cuts. I think it would be undermining the impact to say anything else. I think this is a massive shock. It's an earthquake to the system. It's also an earthquake to the people who are there requiring assistance, as you say.
Where's the area around the world that you're most concerned about? I know we're going to talk about Sudan here in a second, but is that the place?
I mean, all of this is a very new situation that we're in at the moment. So yes, incredibly worried about Sudan. We are waiting to see the impact of waivers when it comes to humanitarian funding. We still need to see what the direct impact on the ground is. I'm worried about the impact in Sudan. I'm worried about the impact in the Democratic Republic of Congo. I'm worried about the impact in Haiti. Across the world at the moment, there is a huge amount of uncertainty. Across the humanitarian world, there is a huge amount of uncertainty as to what the consequences of these cuts are going to be.
On Sudan, you've been the Secretary General of MSF since 2018, but you first started your work with the organization in 2005.
That's right.
Where?
In Sudan.
Sudan. Darfur.
In Darfur.
Would you have ever imagined that we'd be in the position that we are now, the international community? 30 million people in need of humanitarian aid this year alone. The WHO says 9.5 million Sudanese are in need of healthcare assistance. The numbers go on. Staggering numbers. MSF works in 11 of the 18 states in Sudan. You have a very large presence there. Can you alone meet the needs?
Absolutely not, no. I mean, we're doing what we can. But the needs, as you say, are staggering, and not just in Sudan, in the surrounding countries. The refugees in Chad, in Egypt, in South Sudan are also suffering. And so, no, we cannot alone meet the needs in healthcare, let alone the humanitarian needs in food, in shelter, in water. So, no, we can't. And we even before the aid cuts, we were calling for more assistance in Sudan, more resources, yes, but also a braver and more dynamic response. As you say, I started my career with MSF in Darfur in 2005, and I was back there in December, and I came into Darfur through the Adre crossing, which is a crossing from Chad. where a lot of the support to Darfur comes in. And I drove day after day from West Darfur through to Central Darfur to Nyala in South Darfur. And in each of these places, we were supporting hospitals, and they were supplied. They had medical teams working. They had international and local teams working, which really gave me the message: it's possible to do it. It is possible to do it. And at the same time, in terms of looking at the overall humanitarian response, it was the worst I'd ever seen in terms of the scale of the needs and the scale of the response. And back in 2005, I would never have had the luxury, it was a very bumpy journey, to drive all of that way. The security at that time was not good enough to do it. The access was not good enough to do it. And so I came away with a real sense of desperation that as a humanitarian community, we needed to do a lot more than was happening then. And that was before these cuts happened.
Do you think that people around the world really grasp what's happening in Sudan right now?
I don't think so, because I think if they did, then the response would be bigger. I think the pressure on the warring parties, the Sudanese armed forces and the rapid support forces, would be higher to stop what is a really brutal war, which has civilians at the center. It's really a war on civilians. There is the rate of the brutality of the violence is catastrophic, particularly, the sexual violence, women and girls. We've seen children as young as 5 that have been raped. It's a really, really horrific situation in many cases. And I think if the world knew that and saw that, then the pressure to stop it would be a lot greater.
You spoke to the UN Security Council about the situation in Sudan, and you said, among other things, while statements are made in this chamber, meaning the Security Council chamber, civilians remain unseen, UN unprotected, bombed, besieged, raped, displaced, deprived of food, of medical care, of dignity. When you made those remarks in the Security Council, you could hear a pin drop in there. It was so quiet. Has the international community failed Sudan?
Yes, I think that's fair to say. I mean, the way I would put it is failing the people of Sudan. I mean, it is a situation where there are millions of people who have displaced, and yet the support that they're getting, essential support, we're not talking luxuries here, we're talking basics, is not coming through. And where we are at the moment is a few weeks away from the rainy season really kicking off, and that's where the hunger gap, where food insecurity gets highest, the ability to transport supplies and people around gets harder, and so we're really entering into one of the most vulnerable periods of the year as well.
Listening to what you were saying in the Security Council, I couldn't quite tell if you were pessimistic or optimistic on the future of Sudan. Which is it?
I would say I was determined. I think that there is, I came away I've been in Sudan twice in the last few weeks. I came away with a huge sense of pride in terms of the work that MSF and our teams are doing. I also reconnected with people in Sudan. I mean, it's a wonderful country. The culture is amazing. The food is fantastic. It is a place where it is incredibly welcoming. I think we have no alternative in a situation like this, wherever it is in the world, to be determined.
I want to move to Gaza for a couple minutes. I want to read you part of a speech that someone gave about Gaza. The person said, "There is no health system to speak of left in Gaza. Israel's military has dismantled hospital after hospital. What remains is so little in the face of such carnage. It is preposterous." The person that gave that speech was you to the UN Security Council, February of last year. If that's what was the state of the medical system in Gaza then, what is it today?
A few weeks after that speech, I went to Gaza, and at that time, it was before Rafah was invaded, the south of the Gaza Strip, and the hospitals that I visited in Rafah, many of them no longer exist as well. What we've seen is, I'm going to repeat my own words, I think, utter carnage. There are huge areas of Gaza which have been completely pulverized. I mean, look at the north of Gaza, look at Gaza City. There are people who are returning, including our own staff, who are having to use GPS coordinates to find out where their houses were because everything has been destroyed. It is another situation which is unimaginable in terms of the scale of the destruction.
And it has been the most deadly conflict for humanitarians ever. Yeah. More than 220 humanitarians have been killed by Israel bombardment. Yeah. Most deadly conflict for UN humanitarians ever, including your organization. 9 of your colleagues, 9 have been killed in Gaza.
Yes.
Do you want there to be some accountability?
Yes. I think we have there's an obligation for accountability. As an organization, we have an obligation to seek accountability, to seek understanding as to what was happened. I think that this, one of the major factors in this conflict and conflicts all around the world, including Sudan, is the lack of accountability. And I think this is totally unacceptable. I think, we have the vast majority, as anywhere around the world, of our staff are local. And they didn't have the chance to flee in Gaza. They don't have the chance to flee. They're in an open air prison. And they've continued to work throughout this entire crisis. And 9 of them have been killed. I find it completely abhorrent and unacceptable.
I was reading the biographies of some of your staff members that were killed. A doctor, a driver, a woman, a man who was killed with his wife and 7 children. Horrific stories. What do your other colleagues say there?
Well, I mean, I've met, when I was in Gaza, I met one of our psychologists who was running mental health programs for children, and she told me how she'd had 8 family members killed. We're in a situation where we need psychologists for the psychologists. I mean, it is one of the other things that she said to me is that PTSD, post-traumatic stress disorder, doesn't exist in Gaza. It's ongoing traumatic stress disorder. There's no break from it. There's no change from it.
And so in Gaza, they're not saying PTSD, post-traumatic stress syndrome. She's saying it's OTSD,
exactly.
Ongoing traumatic
stress disorder. Exactly.
Incredible.
Yeah, and so it is, it is hard to get your head around what it's like to live in this situation. And so, yes, every one of our staff, they are part of the community as they are everywhere around the world. And the stories that we hear from our staff are the stories that everybody is living on a daily basis in Gaza.
But Israel's not only killed 9 of your staff members, they've targeted your convoys, they've detained your staff, they've bulldozed your vehicles, and on more than one occasion, as you well know, hit an MSF staff shelter. Has Israel used targeting the health system and health workers as a weapon of war?
I think the health system has been targeted as a weapon of war. I think there's also been a disregard for the safety of humanitarian workers and health workers and civilians in general. I mean, I would go further than that. In December, we released a report that said that our teams on the ground were seeing signs of what other experts were saying was indicative of genocide, and that we were seeing clear signs of ethnic cleansing in the north of the Gaza Strip. So I think it doesn't get much more serious than that.
Should there be accountability?
I think there should absolutely be accountability, and I think that we're seeing a lack of accountability in the world more generally.
And are you able to get medical supplies into Gaza right now?
It's been very difficult. There's a suspension of supplies coming into the Gaza Strip at the moment, which is basically holding humanitarian assistance hostage, which is in itself unacceptable. We shouldn't allow humanitarian assistance anywhere in the world to be beholden to political negotiations. People need that, whatever the state of the negotiations. And so that is in itself unacceptable. That needs to stop. We need to allow humanitarian assistance to come in, and we need the world to ensure that that happens.
With all these challenges in Gaza, what is the assessment of the impact of your organizations on the needs to help the people of Gaza?
Yeah, we need a flood of humanitarian assistance coming into Gaza. What ourselves and other humanitarian organizations can provide is merely the tip of the iceberg. We are currently working in 3 hospitals. The vast majority of, or a significant proportion of the hospitals in Gaza have been destroyed, as you said. We're also working in 2 field hospitals because the infrastructure isn't there. I mean, providing humanitarian assistance is more than simply trucks crossing a border. I mean, it is about getting supplies in, absolutely, but it's also about having healthcare workers who have a roof to work in, food, water, medical supplies, and are in a fit state to be able to treat patients. I mean, nobody wants to go to a hospital and be treated by a doctor that hasn't slept for a week, and yet sometimes that's the situation that we're in.
There's so much bad news around the world right now. In your travels to all the hot spots that you work in, what's an example of something where you said, that was a good story?
I have many. I have many, and this is a very important question because the thread that often doesn't get into the headlines or on the news is the amazing stories of love, of care, of tenderness that are happening around the world. When I was in Gaza, I saw a young boy in one of our clinics whose leg was badly burnt from a bombing, and the trust and love that you could see between him and his father, who was there taking him to the clinic every day, was just the most heartwarming thing that I could imagine. I also saw, still in Gaza, I saw we were running a hospital for burns. It's now been, it doesn't exist any longer. But there were 2 young girls, maybe about the age of 5. They were severely burnt. They will be disfigured for the rest of their lives. But they were the only people in the hospital that had the right to roam anywhere in the hospital. And they were sort of the center of the whole hospital community. And everybody was rallying around them. They were talking to everybody. They were the stars of the show. And it just goes to show that, that humanity lives on. There is something much stronger that doesn't get the attention, that doesn't get the headlights all the time. Behind all of these catastrophic, staggering numbers that you were talking about, there's individuals who are also making their lives work, educating their children, looking after their neighbors. And there are stories like this everywhere you go.
Christopher Lockyear, Secretary General of Doctors Without Borders, thank you for talking to Al Jazeera.
Thank you.